Hello everyone and welcome again to the Doctor Show. I'm Dr. Zahra here and we're answering questions, we're talking about medicine, and we're making a lot of things hopefully fun. Today we're going to talk about something that we always wonder about, but we don't know we're wondering about. A lot of weird body quirks that happen, but we don't know why do they happen. They happen from brain freeze to vertigo to excessive sweating and a lot of things. So, before you want to actually have your answer, you need to know the scientific explanation to everything that's happening in your body. Everything, well, almost everything, have a scientific explanation in your body, and I'm here to give you all these explanations. Let's start from the first weird body quirk that happens to my body, which is the brain freeze, or the ice cream brain freeze. Why would it happen? You know, when you're very excited eating your ice cream and then suddenly, out of nowhere, your brain hurts. Why does it happen? What makes it happen? In order to know that, you should know that in order for a headache to happen or something that hurts your brain, your blood vessels, which is arteries and veins, in the front of your headache, they actually swell. Or something in medicine we call vasodilatation. Vaso means a vessel, dilatation means gets widened. So when it gets widened, your head hurts. So what happens when we eat ice cream? When you eat ice cream, the tip of your mouth, the nerves, the little nerves, they trigger the headache and it actually makes your body hurt, your brain hurts. So that's exactly what happens when you eat ice cream and you have a brain freeze. Is it actually bad? Not necessarily very harmful. It's okay to happen, but it's very, very avoidable. How to avoid it? Eat slowly. I know the ice cream is very good, but come on, you can wait a few seconds to eat the second bite, and it's very, very avoidable. So please try to avoid it from happening. What about the second thing that could happen in our body, and we don't know why would it happen? It's something called excessive sweating. Excessive sweating, a lot of people, they have excessive sweating without them knowing why. Or in medicine, the medical term is called hyperhidrosis. Hyperhidrosis happens in very few people. It's very, very healthy. It's a normal variation. It's not a disease at all. Sometimes people have it, excessive sweating in their armpits, and most commonly the palm of the hand and the sole of the feet. Why would it happen? Just an excess work of your sweat glands, and it's very, very rare to happen in the face. If it actually bothers the lifestyle of you or it actually bothers you at some point, there are very few solutions to that, which basically is medications, Botox injections, and if it didn't work, we actually make surgery for it to actually stop the sweat. But it's very, very harmless to happen, and it's not a disease at all. It happens to healthy people, so it doesn't matter if you have it or not. It depends on your actual comfort. So excessive sweating, it's a normal thing to happen. What else happens that could make us wonder why does it happen? There's something called vertigo, or the spinning of the room. Vertigo is when you feel like the whole room is spinning around you. It actually is very different than dizziness. Dizziness, it happens when you feel a little bit dizzy and that's it, but the room does not have motion. The room does not move. So when vertigo happens, it happens because of one small thing in your inner ear. You might be wondering what is happening in my ear. The ear is in general a sense organ. It means it's responsible for one of my senses, which is the hearing. Do you think that the ear is the only thing, the function of it is hearing? That's actually not true. The function of the ear is hearing and balance. Right now, when I'm standing in front of you, balancing myself out, it's because of my inner ear, because it controls the balance. There are little tiny minute hairs inside of my inner ear that are responsible for the balance. So, what happens if a little bit something inside of it goes wrong? This is when I lose my balance, and sometimes I feel like the whole room is spinning around me. This is what causes vertigo. And the treatment is actually very, very easy. What we do, we go to our ENT doctor, ear, nose, and throat doctor, and he will actually prescribe us medications, or he will do a certain maneuver in your head to make you get back to your actual balance, and that's basically it. So is vertigo dangerous? Not at all, but we do have to go and check our ENT doctor. The next thing that we're going to talk about is hiccups. I'm sure we all have hiccups, at least once a month or once every couple of months we have hiccups, and we don't know why do they happen. In order to answer why do they happen, I need to tell you something before. We have a muscle called a diaphragm. A diaphragm is a muscle here to separate our lungs from our intestine and stomach and all of the rest of the organs. What does this muscle do other than separate all of that? It helps you breathe. When you breathe in and out, the muscle actually gets up and down with your intercostal muscles, which are the muscles between your ribs. Together, they make you breathe. Imagine if this muscle uncontrollably moves. So you have a hiccup. Just the uncontrollable contraction of the muscle makes you have a hiccup. But what causes that? When you eat too fast, when you swallow air, a lot of air while you eat. Yes, we do swallow air. Of course, we don't just swallow food. When you drink water too fast, all of these things could cause an irritation to this muscle. A slight irritation to the nerves of the muscle could cause you hiccups. Usually, it's self-limited. It goes away by itself. You don't need to actually do something to do it. But in order for you to make it faster, like it goes faster, you can breathe inside of a bag, breathe in and out. You can drink water, and all of these things that usually people say, they might work, but usually it goes away from itself and it's harmless. It's very, very harmless. What else is there very weird that could happen? Do you know when you go to an airplane and then suddenly you try to swallow to make your ear pop? The ear popping. It actually happens very, very often, especially here when we live around the mountains and we go up the mountains and all of that, and we feel like there's a pressure on our ear. What happens in there? Usually, the pressure in the surroundings with the pressure inside my body is the same. That's why I don't have an ear pop at any time when I'm walking in a normal room. But when I go to a higher altitude, it means the pressure gets higher. So the pressure is unbalanced between my body and the outside. So what happened from the middle ear to your throat, there is a small tube called the eustachian tube. This tube actually connects the outer atmosphere to my inner atmosphere, and it helps balancing the pressure. So what I do is when I try to swallow or just hold your breath and close your nose and just blow gently, it makes it pop, which makes me have equal pressure on both sides. Of course, make sure you don't blow very, very hard. You don't actually try to harm your eardrum because it might cause it to pop. Other than that, it's very harmless to do so, and that it happens very, very normally because of the pressure difference in the air. Other things could happen. There's one thing that is very, very interesting to happen. It's called the Charley Horse. What is a Charley Horse? You know, when you're sleeping, like you're in deep sleep and you're very cozy and very happy, and suddenly, out of nowhere, this muscle hurts. This muscle contracts suddenly and it hurts so much. You didn't even move it. You didn't even do anything that might cause this pain to happen. Why does it happen? The phenomenon is called the Charley Horse. Why does it happen? It happens because usually it's because of dehydration or the overuse of muscle or a nerve irritation. If you exercise so much and you used it too much today, it could cause it while you're resting, sitting, or maybe sleeping. And if you are very, very dehydrated. Guys, I always tell you, drink enough water. We have to drink up to 3 liters of water every day. So make sure to get all your enough water, because if there's less fluid on this area, you might actually have the calf muscle spasm. So whatever is happening is the spasm of your calf muscle, and it actually is very, very, very painful. What to do to actually make it disappear? You make sure to stretch out the muscle, you walk, and you try to make it feel less painful, and that's it. Just use the muscle, just make it a walk, and drink enough water. This is what we do to make it actually disappear, and I hope nobody has it, because it actually is very, very painful. What else? Sometimes we have something called earwax buildup. Do you know what inside of your ear, when you have this yellow earwax, there's a big mistake that people do, that they think the earwax is all the dust from the outside and all the dust particles. Do you think that's true? Well, kind of, but the actual earwax is something my body does. My body produces. The earwax is produced from my ear. Do I produce anything that is harmful for me? Of course not. The earwax is there to protect my ear from all the bacteria outside. So the earwax is a protective method from my body to actually protect my ears from the bacteria. So do you think it's very wise for me to take it off? Absolutely not. So we actually have to clean once a while to make sure there's no buildup. And by the way, sometimes when we clean it in a wrong way, we push the cotton inside of your ear, and you actually make it go inside and make it have obstruction and buildup of the ear. And that's very, very, very unhealthy. You need to go to your ear, nose, and throat doctor. He might have to actually irrigate it himself or take it manually to make sure your ear is open. So you have to actually know when to clean it. You don't have to clean it every time you shower. No, you clean it once every long while to make sure there's no buildup, and that's all. Because we have to let the earwax do its job, which is keep all the bacteria away from your body. If the bacteria got inside your ear, you might have infections, you might have serious diseases, and we don't want that, right? So something else actually happens in our eye that we cannot control, and it's very weird to happen once in a while, which is the eye twitching. You know, sometimes when you're just sitting out of nowhere and your upper eyelid or lower eyelid just start to twitch out of nowhere. Why does it happen? It could happen because of stress, because of fatigue, you're actually very, very tired, because of your dry eyes, and all of these things are very normal to happen to all of us. But sometimes it happens due to more of neurological diseases, like a disease called Tourette syndrome. This disease is actually very rare, and it's actually known because the singer Billie Eilish has it. Sometimes in her interview, she sits down and out of nowhere, her eye twitches, her eyebrow moves uncontrollably. She cannot control it. This is actually a neurological disease, but when it happens to people who do not have diseases, normal people like us, it actually happens because of the dry eye and the stress and all of that. What to do to avoid it? It's okay, it's very, very harmless. It happens, it goes away. Few seconds, up to a few minutes, and that's it. You don't need to do anything to make it go away, but make sure to stay away from stress, to stay away from overexhaustion, and from dry eyes. Another thing could happen, especially to boys. It's your turn now, boys. When it happens to very, very young boys, teenager area, like age, and to old people. What happens? It's the overdevelopment of the male breast. Yes, a lot of teenagers have it, a lot of young children have it, and old people have it. What happens? In order to know what happens, you have to know that there is a hormone, again, I'm gonna explain it again. It's a substance, a kind of protein that is released from a certain organ to go to another organ to do a certain action. In this case, we have a hormone called estrogen. It usually is very, very abundant in females, but males, they have it very little of it. And another hormone called androgen is the male hormone. In puberty and in teenage age, we have an unbalance or imbalance between those hormones, and the estrogen might get high a little bit, so it could cause the development of the breast. Does it go away? Definitely it goes away, and within a few years. And the children as well, the whole imbalance happens. But what happens if someone very old has it? It could happen because of an underlying disease, like liver disease, like kidney disease, and all of that. So if an old person has it, they have to make sure to go to a doctor to find the underlying cause. Because it doesn't just happen because of hormones, it could happen because of a lot of drugs they've taken or a certain disease they haven't discovered yet. So please, if you have someone old who has it, make sure to know the cause of that to treat the cause of that. The last thing we're going to talk about, our weird body quirks, is the excessive hair growth in females, or as we call it in medicine, hirsutism. What is hirsutism? Approximately 5% of all women around the world, they have a lot of excessive hair, more than they could actually be pleased to have. Of course, it's a very unpleasant thing to have, and it's very annoying. It could happen because of many reasons. One of them is genetic. You could pass it on to your kids, and you have it from your genes from your family, or it could be caused by a certain disease, like something called polycystic ovary, or PCO. Polycystic ovary, it means a disease in your ovary that could cause excessive hormone of males, which is called androgen. This excessive hormones of males could cause you excessive hair on your face, on your hand, on your forearms, and all of that, which will actually could be treated by regulating your hormones, by drugs, and by going to your doctor. If you doubt, you're in your teenager age or you're in your early 20s and you have these symptoms, make sure to go to a doctor. We will have a whole episode talking about female diseases like polycystic ovary, so please make sure you watch us and stay tuned to watch us talk about that. But for now, the hirsutism in general, not just PCO, the treatment of it, hormonal regulation, I go to a doctor, they regulate my hormones if I have an imbalanced hormones, or they eventually give me drugs, or I would have a hair removal by laser, and that's basically it. It's actually very, very harmless. We treat it only if we have an underlying disease or it actually is bothering the person who has it. Today, we only answered those weird body quirks that could happen in your body and we don't know. I hope I gave you some scientific explanations of them. Please, if you need to ask me anything, always find us on social media and write down your questions in the comment section, and I'm here to answer. Thank you very much for watching, and I'll see you next Tuesday. Have a good day.